I have in front of you a little bit of our data that we've seen from the beginning of the pandemic. A couple of lines I want to point out and walk you through. First, there's a yellow line in here, right? That yellow line is the number of positive patients that we're treating for COVID-19 in our hospitals at Mary Washington and at Stafford Hospital, really from every day all the way from March till now. And I want you to come over to the right side of the screen there and look at November 1st, when we had approximately 15 patients that we were caring for between Mary Washington Hospital and Stafford Hospital. And look what has happened to that line from November 1st until now. And the slope and the increase in that line really throughout the entire month of November. The steepness of that slope, it's never been higher. The line on top of that, the orange line, that's the number of hospitalized patients in the whole state of Virginia. And you can see from the beginning of November as well, that slope is also very, very steep. And so it's why we started these town halls again, is to make everybody aware, hey, the prevalence of COVID-19 in our community has never been higher. And there are more hospitalized friends, family members, and loved ones in our hospitals right now that are trying to fight COVID-19 than we've ever had at any point of the pandemic. And so we are imploring everybody again to take action to flatten the curve. We have to start talking about that again. We can't have the slope go up like it's going right now. We need to flatten the curve. And the good news is, throughout the course of the pandemic, we know more. We know the things we have to do, the things that we can do, each one of us, to flatten that curve. And that is, everybody needs to wear a mask, right? Wear a mask. It protects you and it protects others around you. Social distance, right? Extraordinary hand hygiene, right? And right now, at this point in time, with the positivity rates like we have, stay home if you can, right? Stay home. Don't be around others at all, right? That will really decrease your risk. Stay with your home unit who lives in your household, right? Those are things we can all do to flatten the curve. And so everybody here who's tuning in tonight, I know you're very interested in seeing what's going on. You can spread the reach, though, of the message that we're giving today, right? Everybody can talk to 2 or 3 friends and say, hey, I tuned into the town hall last night. Cases have never been higher. There have never been more hospitalized patients in our Rappahannock region than there are now. We need to all take action and take steps to flatten the curve. And that's what I'm asking everybody to do here today. Currently, we have 60 patients hospitalized between Mary Washington and Stafford Hospital that we're caring for. It's never been this high. We've never had this many hospitalized patients in our community that have needed care to help them battle COVID-19 in a hospital. So we're imploring everybody, let's keep, we also talked a lot in the spring, keep this within our capacity to make sure everybody can get fantastic care. And so in order to do that, we need to flatten the curve at this point in time. And I would appreciate everybody who's taken the time to listen tonight, if they could help us spread that word in our community.
Yeah, our workforce is getting weary. This has been a very, very long battle, since early March that we've been undergoing. And it's like I said, the analogy is like everybody has just finished running a marathon, and now they're being told that was just the warm-up. So our healthcare providers are working so hard for our community, but they are getting exhausted. And the curve that Dr. McDermott showed is unsustainable. We cannot sustain that growth in hospitalized patients here in our region. One of the most important aspects of flattening that curve is preventing a health system from being overwhelmed. If we are overwhelmed, we're not going to be able to take care of you when you come here for COVID or any other reason you may need health care. If we overwhelm our health system, we're going to be watching, just like we watched what happened in Italy and what happened in New York City. We do not want that to happen in Fredericksburg, and we are getting very, very close. We have many, many very sick patients, ventilated patients, the most patients with COVID in our ICU that we've had since the beginning. And and this trajectory is just absolutely unsustainable. So really, for the sake of our healthcare workers and our community, so that we're here to be able to take care of people, this is the time to flatten the curve. It's very serious.
Thank you. We found a community question that I think speaks to that, Dr. Newman, is how do these inpatient numbers compare to the capacity of the hospital? In other words, how close are we? We've seen in the news that the mayor of Los Angeles has said we may reach capacity, their hospitals may reach capacity by the end of this month. What does that translate here?
Yeah, our ICUs at Stafford Hospital and Mary Washington Hospital are at capacity. And this is not about ventilators or building more beds or field hospitals. This is about ICU nurses and physicians that have the training and the capability, respiratory therapists, to be able to adequately take care of you. We are at that capacity now in our ICUs and system and healthcare system. And if we continue on this trajectory, it will not be sustainable.
Do we have a plan on how we can add more ICU beds if necessary?
Yeah, we have contingency and surge plans in place where we can utilize other staff, as we've talked about in the spring, anesthesia, OR staff, and others that can lend a hand and help out as we utilize other parts of our hospital as ICU. But that is not ideal. That's not going to give people the ideal outcomes that we have been really having here as a health system to keep the mortality rate low and provide adequate treatment for everybody. So, I do have concerns. And again, everybody had more energy back in March and April. This has been a very, very long, hard battle. And this is not the time to overwhelm our healthcare providers. So it's very, very hard. I think there's fatigue, as Dr. Bonds had mentioned, with the social distancing and isolation. And I think everybody, I know somebody who's had COVID, they got better, it wasn't that big a deal. But the odds are not always the best there. You do not want to play that odds game. And if hundreds and hundreds and hundreds of people in our community become positive, yes, many will get better, many will be fine, but there's a percentage of them that will require hospitalization, that will get very ill and will die. And, we're getting to that point where our healthcare system here locally is getting overwhelmed.
And it could be you, right? If you get COVID, you could be the one who decompensates and requires hospitalization to help you fight COVID-19. We can't predict who's going to require that care or not. And I think it's very important, that what Chris is speaking about, people know, well, we have 400 some hospital beds in our hospital, but those, a lot of areas of our hospital are very customized to treat very specific types of disease. And the individuals and healthcare workers that work in those areas have a very specific expertise. We cannot care for 400 hospitalized COVID patients that require intensive care unit care. We can't do that. We don't have the expertise to do that. And so we need to keep that in mind. That the trajectory we're on right now, it's why we've restarted these town halls. It's unsustainable, and we can take actions. This is the thing, we can control it with our actions and our activities as a community. And if we all take actions, limit our activities around others, always wear masks, we can flatten the curve. It's something, it's within our control. And that's why we have to raise the word, spread the word. Everybody who's tuned in tonight, talk to 4 or 5 others, tell them about this, why it's important right now to take action, especially we know we had the Thanksgiving holiday gatherings. Those aren't even factored into our numbers yet. And we're looking into the Christmas season and times when I know it's natural for people want to spend time around others. We have to resist that based on the data and in order to keep everybody safe.